Hey there, and welcome. I'm Anna Hartman, and this is Unreal Results, a podcast where I help you get better outcomes and gain the confidence that you can help anyone, even the most complex cases. Join me as I teach about the influence of the visceral organs and the nervous system on movement, pain, and injuries, all while shifting the paradigm of what whole body assessment and treatment really looks like. I'm glad you're here. Let's dive in. Hello. Welcome back to another episode of the Unreal Results podcast. Welcome if you're new here. First of all, last week's podcast with Missy Bunch, which was just an impromptu IG live. Posts from that, like social media posts from that recording, went a little viral, which I wasn't expecting. Of course it's that way because it's like something that you didn't really like. It was just kind of off the cuff with Missy and I, and shout out Doc Joe O, the old podcast editor and YouTube editor for the edits of the clips, and like one of the clips just took off, which is great. And then since I had done like a secret sale on the Never Treat the Shoulder First online course and the nerve workshop, I posted some more content around basically what we're saying. Like literally just like I did another video of, it was an old video of the cross leg lift exercise, which is the exercise I had Missy do on the live, which is also clipped in the clip from Joe. So literally like repeated the same thing in a more of a tutorial format. And it blew up, which is so funny because it's old. I shared it in 2024 and it did well, but it didn't like blow up by any means. I put a hook on it, which basically was like, I think I said like, you can do thousands of reps of serratus punches or scapular push-ups, like plus push-ups, or you could do 4 reps of this exercise for scapular stability and see results after one set. So, I mean, obviously it was a good video however many years ago when I posted it. Still a good video. Don't know if it was the hook or just like the algorithm pushing the content since the previous content did so well with Missy or what. But anyways, it did really well, and I gained like 600 new followers from it, which is kind of crazy. In a perfect world, that would be 600 practitioners, but I doubt it is because it was an exercise post, so you get a lot of like regular people too, which is fine. I'm all for helping regular people, but yeah, so if you are a provider that found me from that post and maybe are listening to the Unreal Results podcast for the first time, like welcome. And then to everybody who is like diehard listening, thank you for being here. And I hope you enjoyed that podcast too. And if you haven't seen the tutorial on Instagram, like head on over to Instagram and check it out. So anyways, I'm like, why did I talk about that? It's just my mind's a little blown from it of like, wow, my Instagram's been really busy right now. Which is a good thing. So this weekend I was home, and I live in a touristy part of town, and there's quite a few like little day spas in the area. I think most of them are like Asian style day spas, like reflexology, those type of like more Asian massages, like shiatsu massage, Thai massage, etc. Normally when I get a massage, well, let me tell you a little history with massages. Okay, and also land the plane. the reason why it's like I was like, yes, Saturday I decided to go get a massage at one of these day spas in my neighborhood. That was the whole story about that. But let me tell you a little history of me and massages. So I've never previously, I've never really loved massages. First, it was like I didn't love laying on the table. It was hard for me to relax. I had a really hard time relaxing. I just didn't see a purpose of it, and it was pretty painful. Then I progressed to part of the reason it was hard. Like at first, it was just hard for me to relax because I couldn't stop thinking. Then, as I got to be a professional, it was hard for me to enjoy massage because I was critiquing people the whole time. And which is a real thing, and not like critiquing them like verbally, like openly critiquing them, but just in my mind being like, no. And then if they said anything about anatomy or stretched or tried to tell me something about my body, I was just like a little turned off to it. So, but with that said, like I find a lot of value in manual therapy, obviously, and it can be helpful. And eventually I started to get over the being able to relax thing, and I also started a little bit being able to get over the critiquing, only because I finally found a good couple massage therapists. It had people that I trusted, and so like that kind of let go. So then but it was still pretty painful. Then I started getting regular lymphatic massage for just, I was having just a lot of like bloating and general lymphatic congestion. And so I started getting regular lymphatic massage and for that. And a side effect of the regular lymphatic massage was I noticed that then when I would go get a like deep tissue massage or like even a Swedish massage that was kind of like a little deeper, I didn't have a ton of pain anymore. And so that was like a really great, that was a really great epiphany of like, oh, wow. Yeah. When your lymphatic system is like overwhelmed, backed up, you're just kind of pretty toxic and the muscles are ouchy because of that. And so, since all, it was like I did regular lymphatic work, and I mean regular of like, at first I started out weekly and then or maybe even more than once a week at the very beginning, but then weekly. And then that went to like every other week and then every 3 weeks and then every month. And I kept up with it for like 2.5+ years. And like even now, even though I don't get regular lymphatic work, I tolerate massage touch much better now. So it can be more enjoyable. I have a regular massage therapist here in San Diego that I love and trust and who has taken my courses, that does the L-tap on me. I've talked about her before. She's been on the podcast before, Julie Areola. She's great. She's up in like Carlsbad, Oceanside area. But she can be hard to get into because she's so good and has a regular schedule. And then also that's like 45 minutes to an hour plus away from me given traffic. And I just on a whim this weekend was like, well, not a whim. I've been thinking like, oh, I need to reach out to Julie to see if I can get in, and then just not doing that, but then also being like, I really need some just general massage stuff. And not only general massage stuff, it's like I just specifically would really love someone to work on my lower legs because I've been having some Achilles tendonitis-y type symptoms for a couple years now. I've talked about it on podcasts before, I'm sure. And it comes and goes because part of it is just symptoms of it. I don't think I'm sure I have some sort of tendon pathology, but I don't think it's as bad as it feels because I know part of the pain and the sensitivity is because of the swelling from the lymphatic congestion. So I've been meaning to do both, like get back into some regular lymphatic massage with the amazing Linda Ann Kahn, lymphatic specialist that I'm lucky enough to have here. She lives here in San Diego. But also, my calves are really tight. Like I have exertional compartment syndrome. I have large calves. I think a little bit of that is genetics. Shante Cofield, the movement maestro, the other day, a few months ago, we went to dinner in LA and we were like walking up the stairs and she was behind me. And then like a couple days later, she texted me. She's like, oh my gosh, I meant to tell you when we went to dinner. She's like, no wonder you have compartment syndrome. She's like, you have the tiniest ankles and the largest calves. And I'm like, oh, actually, it's very interesting that she said that to me because I see that in my athletes a lot too. They have large calf muscles, but then kind of smaller ankles, and especially have a lot of tension around the extensor retinaculum, which tends to be a entrapment area of some important nerves and vascular structures. And so it was cool to hear her say that because I'm like, yeah, no wonder. And so also I've just been wanting someone to just like do spot work on my calves, much like I do for my athletes, and just like dig in there because it really helps not only for the entrapment areas, like the extensor retinaculum, but just like the tight, stiff muscles that are there from life. And then that deep tissue in the calf, more so than lymphatic work, really helps to get the fluid and the congestion out of there. And so it's really needed. And unfortunately, as a whole in the industry, massage therapists and manual therapists, whether they're physios or physical therapists or athletic trainers or chiropractors or whoever, they tend to suck at lower leg massage. And I'm not really sure why that is. Other than like inherently when athletes, and maybe this is just in athletes, but when athletes or people with tight calves have tight calves, it's really hard to do deep tissue in there. And it's hard on your hands, and it's hard to even feel like you get anywhere. And then it's hard to even sometimes feel the tightness because there's so much pressure. And I've talked about this before, maybe even in a past podcast that I'll have Joe link in the show notes about the soleus, and probably in the shin splints episodes, I've talked about this too. So I'll have Joe link those 3 episodes, talking about how when we have especially some extra fluid in that area, the pressure that it creates in the lower leg, it's like having a full can of soda. It is really hard to deform that can of soda when it's full of fluid. And first you got to get the fluid out, and then you can start to kind of deform it. So it's the same thing too, is I find in my athletes, like at first I'm fighting against this pressure system. And it's like, this is also why the sequence to where you touch first and where you treat first is so important. I'll have Joe link in the show notes, the swelling reduction podcasts I've done too. I've done 2 of them because sometimes in order to be able to get good work done in the lower leg, you need to do some other areas in the body. And I'm gonna relate this back to my experience on Saturday too. Anyway, so this is also like, I preface all this, the whole story about Saturday really is not the podcast. The bulk of the podcast, I'm going to talk more about the lower leg anatomy and like my sequence of doing massage in the area to support the lymphatics and the vascular flow, as well as to actually get into the tight muscles and like help them not be so tight anymore. And y'all know I hate the word tight, but sometimes that is just the best way to describe it. So, So going back to Saturday. So now you know the reason behind why I was even like seeking out, I'm going to call it general massage. And why even I actually was like, you know what? These day spas, these Asian day spas in my neighborhood, they might be even better because as a whole, I'd say because the Asian massage day spas usually come with like quite a bit of emphasis on the foot and foot reflexology. I was like, at least I know they'll do a good job on the foot and the calf. And maybe a good job is like in quotes, like they'll spend time on the foot and calves, more time than if I went to like a massage MV or a just a massage therapist in the wild. Because I've been to massage therapists in the wild that are like more formalized, like therapeutic massage therapists. Maybe they have their own practice, or maybe they're in a massage MV, or whatever the other ones are called, Elements Massage, like all those different massage places. I've been to massage therapists that work at fancy spas, at resort hotels, and across the board, whenever I've come into them and told them, when they say, hey, what brings you in today? What would you like to work on? I say, please don't work on my back at all. You can do a little bit on the shoulders, upper back. Don't touch my neck. Don't touch my back. Please focus on the limbs. I would really like a lot of focus on my lower legs and then my hands and forearms, because as a manual therapist, like my hands and forearms, like again, like I'm like they're my my forearms are so stiff, my thumb muscles are so sore. I would love for literally like an hour massage for 15 minutes on each limb. You don't have to touch my back at all. But yet, because of most massage therapists training and then most of the ways they practice, they have this sequence that they go through. It's very hard for them to not spend time on my back. And it infuriates me. Not for any other reason other than I was like, you literally just asked me what I wanted. I told you, and then you're not even doing it. And or it's like they'll like start on my limbs and they'll be like, oh, these are not too bad, and then continue on. And I'm like, what does bad even mean? So anyways, so I was feeling like pretty good about this choice to go check out one of the day spas on Saturday. And I get there and I had selected the 60-minute foot and body combo massage, foot reflexology and then body, 60 minutes. And I was like, great, like perfect. Like I'm thinking it'll be a 30-minute like foot thing and then like a quick rest of the body. And she has me like start face down and then she starts on my back and then doesn't even ask me what I want. But I'm like, it's okay. Like I signed up for a specific package, a specific thing, right? And so then she's like going on my back and she's a little deep, like many, again, Asian massages are, a little deeper than I would like. So when she asked how the depth is, I was like, that's plenty. That's good. Plenty. No more than that. And then she proceeds to go deeper. And I'm like, what the heck? And so then she kind of does like a general full back. And then she says, pauses, and she's like, is there something that you want me to focus on today? And I said, oh, yes, thank you. I would really love you to focus on my calves. And she goes, what? And I was like, my lower legs. And she goes, oh, yeah, okay. And then she does a couple things, and then she starts like going to town on my low back. And I'm like, okay, well, like I could see how like if someone asks for their lower legs, I might do a little something at their lumbar spine because I know, like the nerves innervate the legs down there. Like that's valid. And then she just is going, like continues to like go low back. And like, I'm like uncomfortable. Then she gets deeper. So I'm like, hey, not that deep, please. And she just continues on. Okay, my fault. I should have at that point been like, hey, could you stop doing my lower back? Maybe you misheard me. I'm lower leg, like my legs. But she continues on. And then she gets to my hips, and then finally my legs. And I will say that the side of my Achilles tendonitis pain, my hip was really tight. My hamstring area, like where the tibial nerve comes out of the hamstring, very, very tight too. And so I'm like, in my brain, I'm like, oh, even though she's not working on my calf, I actually think this is helpful because I'm like, I must have some entrapments a little bit higher up that's causing some of these problems. And so, she does her thing and then she gets the calf and it's tight and I feel her like getting in there and then she like switches legs and I'm like, oh, dang it. And so then she does the other leg and then she does the arms and then she has me flip over and does some like face stuff and then she's like, okay, we're done. And I'm like, oh. I feel like I was murdered. Number one, my back is so sore. And here's the thing. The reason I don't like people touching my back is because I have a lot of segmental instabilities in my lumbar spine. And I tend towards hypermobile. I wouldn't say I am hypermobile, but I'm very mobile. And I'm someone who needs more stiffness in their muscles than mobility, and especially in my trunk around my spine. And so the reason why I don't like deep tissue or any massage work at all really in my lumbar spine especially is because it breaks any of the neurological stiffness my body has created and also like diminishes a little bit of like I'm just going to say the neurological stiffness that my body has created to provide some stability around those segments that I have significant segmental instability and have 3 extruded discs. I had back surgery. I'll have Joe link that podcast in the show notes too. My back surgery podcast. I also believe there's 2 of them. But that's why I don't have people touch it, because any amount of deep tissue in that area destabilizes me to the point that I get off the table and then like it takes barely anything and I feel like disc issues and like start to get back pain. And the whole thing with the back pain, I don't have back pain anymore. I've gone so long with like minimal back pain or like kind of just general back pain here and there with life, but like not the back pain I had that led to the surgery for so long that I almost sometimes forget that I had the surgery. And I think that was my thought process during the massage was like, okay, well, I don't normally like it when people do my low back, but you know what? I've been feeling so good for so long and like maybe a little bit wouldn't hurt. But she did too much. I probably would have been fine with a little bit, but she did too much. So anyways, I leave the massage and I'm like, I can tell. I'm like, oh my God, this is not good. I have like no stability in my spine. So then I'm like, you know what? I'm going to go for a walk. Maybe like some movement and walking will like create something for me. And I like considered even doing some lifts, but I was like to create some stiffness. But then I was like so unstable that I was like, I don't think a lift's going to be smart here. So I ended up, the only bit of comfort I actually ended up finding is I took my sweatshirt and I tied it around my top of my pelvis as tight as I could to provide some stability, almost like an SI joint lock belt. And then I kept that on for like 3 or 4 hours, basically until I went to bed that night. And I felt so much better when I took it off. And so that was good. And I feel lucky that I understand what happened and I was able to troubleshoot how to like not make it turn into a big thing. I will say on that walk and then my walk the next day, my Achilles does feel a little bit better. Still not great. Still have this feeling of like, man, I would have loved some work on my calf. But it also continues to tell me that like a fluid thing is a big part of it. And then like I might have some entrapments of the nerves higher up, like I said, in my hip, in my thigh, that might be driving this too. So my biggest thing with that and why I wanted to tell the story around this is because for a couple of reasons. Number one, I don't think this is specific to massage therapy. In terms of a patient comes in, tells the practitioner what they want or what they think they need, and then the practitioner doesn't listen to them. Or they hear them, but they don't listen to them, right? Or they just push the agenda. And this is a conversation that comes up a lot in the LTAP, because the locator test assessment protocol is a way for the body to tell us where to go. But at the same time, a patient comes in and like has a desire of why they're coming in. And so we need to make sure we're connecting both of them. So I spend a lot of time while I'm teaching in the classes, like giving that as an example, okay, of how to marry those two things together for the patient and for yourself, so that the patient feels seen and heard, gets what they want, and then also you as the clinician get to listen to their body and figure out what their body wanted and give them that too. And then here's the spoiler alert. What you want to do as a practitioner actually doesn't matter. That's your ego driving your practice, and like that's the no-no. And sometimes ego is a lack of confidence and like a reliance upon doing things that are comfortable and habitual. And that's what happens a lot in the massage world, is like you learn this sequence of doing the massage and getting the whole body in the full session. And it's hard for you to navigate away from that. It feels uncomfortable. There's a lot of cognitive dissonance with it. And so it sometimes feels like, or comes across as you not listening to the patient, when really it's just your ego having a hard time letting go of the normal, comfortable pattern it's used to, right? And when you don't have something like the LTAP to help guide you too, it's like, a little harder to just go with what the patient wants sometimes. So there's that. And I don't, like I said, I don't think it's like specific to the massage therapy industry profession. And I'm not like dumping on massage therapists here, because it happens in every profession. And then also in every profession, there's a lot of crappy practitioners out there. It's probably not you. You're listening to this podcast. It means you like to learn and you like to think outside of the box, and you're like literally listening to educational podcasts in your free time. I promise you are not one of those practitioners. But as a consumer, it's hard to pick. It's hard to find it's hard to find good people. And so this is part of the frustrating part, right? So I did want to share that story to highlight those things. And then I also wanted to share a little bit before I dive in on the anatomy of the lower leg part of the podcast, which I'm sorry, I know it's like 30 minutes in and I'm not there yet, but I wanted to also be like, I have no, like, again, I'm not a massage therapist, so I don't know about the industry's regulations, licensures, certifications, etc. when it comes to businesses. And I can imagine that maybe there are some massage therapists out there that look down upon like the Asian massage day spa type places. And somebody said something in I had posted on Threads, and somebody had said something in Threads about that. And I was just like, I have a problem with that. So I don't have a problem with it if the people are not like properly licensed to touch, right? Like I appreciate the need for some sort of regulation and protection of the consumers. Okay. So we're going to use the assumption that the people that work there are actual licensed massage therapists or have some sort of license to touch. Whether they are, I don't know. But the looking down upon them as less than because of the style of massage they do, or the cost it is, right? They get a lot of business because it's low cost, right? Is very ironic to me when the industries as a whole, massage, physical therapy, athletic training, chiropractor, when all of these well-educated, I say that in quotes for people that are not watching the podcast, all these well-educated hands-on practitioners are literally using traditional Chinese medicine tools and techniques on a regular basis, kind of whitewashing them, for lack of a better way to think about it. using cupping, using gua sha, which is the Chinese word for tool-assisted soft tissue, using acupressure, using, I don't know what culture reflexology comes from, but like using these practices that come from a lot of Asian medicine, whether it's traditional Chinese medicine or Korean medicine or Japanese medicine, whatever it may be, ancient medicine. And then it's funny to me that all these practitioners use those tools, but then at the same time, like, shit on these businesses as if they're less than. And I'm like, just, I wanted to throw that out there because I think sometimes we do things like that without sort of like taking a second to think about it and think about like the people on the other side of it and also like appreciate that, even on the flip side, if you want to go devil's advocate and be like, well, they're not licensed massage therapists. I'm like, okay, how did they learn this craft? How, like, I don't know. I just think it's like it's an interesting that dynamic that you see in the world. And I'm also like, a lot of it always comes out of like jealousy of like, or like a feeling of like they're taking your potential patients or like you're making your profession look bad. I got news for you. There's plenty of non-Asian massage places full of all different types of people providing massage, providing physical therapy, providing athletic training, providing chiropractic services that are shit and licensed. So that has nothing to do with it, right? So it's like, and I'm also like, especially in the state of California, we live in a state with 39 million, billion, who knows how many billions of people. I promise there's plenty of business for everybody. And that's also like, yeah, your job as a professional is to advertise yourself of why you are different, what makes you unique. So then when I'm Googling who's in my area that I can pick from, I'm more likely to pick you versus somebody else. Okay. So anyways, those are my kind of like, that's my social sandbox on it. It's like a few sandboxes on this. First one, the social sandbox of that, cultural appropriation part of that. And like professionalism on that. But then two, the actual lesson here of like, are you listening to your patients? Are you meeting what they want with what you think they need? And is what you think you need, is it being guided by your ego or actually a thorough assessment? And then also, there's this lesson of like, why reaming on someone's low back when they have back pain might not be helpful. And then the final lesson is, which I'm going back to, which is why I went there in the first place, is this lack of real great work around people's calves. And ironically enough, Instagram, the algorithm, I love it. After I had this experience, I was served a reel from Move You people. They're the guys who like paint the anatomy on somebody's body and then like show you movements or manual therapy. And they had one on the posterior tib and he was like digging in there and he was like, oh yeah, it's so painful and digging in there. And I'm like, okay, let's talk about this a little bit too. So maybe I'll just dive right in there, because I will say too, like most of the techniques I do on people, because I have implemented a lot of the osteopathic therapy, is not that painful. But the lower leg work is still very painful. All of my Navy guys, they're like, when I get in there, even my athletes, they're like love to hate it. That's what I was looking for, is some deep tissue in that area. And these guys, they describe it as the pain cave. Some of them are like, okay, we're ready to go to war. Like, Most of them at one point are like, oh my God, you must have the strongest hands of anyone. Like, there's a lot of comments about like how uncomfortable it is. Okay. There's some reasons for that. First reason it's uncomfortable. Number one, the lymphatic piece, which I already shared about, right? Like, how do you have a fluid congestion problem? Is your lymph pretty like gross and toxic? That could be why it hurts. Number two, do you have a fluid problem? If there's fluid in the area, it's going to take a lot of pressure and a lot of work to get that fluid out. And then oftentimes these deeper muscles are neurologically tight because they're weak, because they haven't been doing their job. A lot of times because the nerves have been entrapped and like strangled within the compartments from the fluid or from the, some fascial restrictions, much like the superior extensoretinatum, like I talked about with my skinny ankles. So those muscles often like are active trigger points basically, and that can be painful. Okay, and then the another reason why it can be really painful is because when you're doing deep tissue on this area, there's a lot of nerves down there that are some are superficial, some are deep, but either way, most of the time when something's really painful in one specific spot, it's like you're compressing a nerve. And the nerve, when you're compressing a nerve, it's always going to hurt. It doesn't feel good. Nerves don't like to be compressed, right? So there's a little bit of like, and why this really reminded me of that is he was like, oh yeah, you got to get in there and it'll be really painful. And like, it's painful for everybody. I'm like, oh yeah, there's a very specific spot, which is often called the posterior tibialis, which is, it's not the posterior tibialis, but it's like very distinct spot there on the posterior tib, in front of the posterior tib actually. That the tibial nerve is right there and the sural nerve is right on top of it, and you're compressing two nerves and it hurts every time. And so like you do have to kind of keep in your head the anatomy knowledge of the lower leg, so you realize like what feels tight. There's a difference between something feeling tight to your hands and needing the manual therapy, and then pressing on something and it hurts and thinking that the reason it hurts is because it's tight and then pressing on it more. That's not the reason, right? So there's that. And let's talk about it. Let's talk about this. I think it's best if we talk about the sequence I do things. The sequence I do things in the lower leg are very specific in order to address entrapment areas first of the neurovascular structures. So if there's any neurological tightness of the muscles in the areas protecting those neurological structures, it decreases. And so the sequence is like this because I found that it often decreases the discomfort. Even though my guys would argue with you because it's still a pain cave, it actually could be a worse pain cave if I didn't start this way. And do I know this for facts? No, I know this from experience in my own body and on my athletes. And so it seems to have worked over time, so I do it that way. Also, it seems to be the sequence of which the body often directs me to. And so it's like I've treated enough people now, and I'm using my general listening, local listening, and my inhibition test using posterior tibialis pulse that I'm like seeing these patterns as well. So as I go through the sequence, we'll talk about the anatomy as well. But just like a real general reminder of the anatomy of the lower leg, it's in compartments, right? So we have, I always kind of explain to my patients, we've got like the main hot dog casing around the lower leg, right? That's superficial fascia that goes all the way around it. Then we have those septums that are like similar to the superficial fascia, but like make separate containers. So you have a separate container for the lateral muscles. You have a separate container for the anterior muscles. You have a separate container for the posterior muscles, 2 of them. You have a deep container, deep posterior compartment, and a superficial posterior compartment. And it's between those compartments that the neurovascular structures run. Okay? So most of the time I start in the anterior and lateral compartments. I let the body tell me where first. It's kind of a trade-off of which one's first, the lateral or the anterior, but they usually are together, and they're very similarly together, like anatomically. The anterior compartment is a little bit more lateral. And the thing here, in the anterior compartment, you're going to visualize, feel the pressure quite a bit, see it sometimes on the like sheeniness of the front of the anterior tib there. The key spots for entrapment are going to be around the proximal tib fib joint and then about halfway down the shin along the bone, and then about 4 fingers above the lateral malleolus, maybe even right below that. That's that superior extensor retinaculum. So those are the 3 spots. Also correlates with the lateral compartment, those 3 spots. Usually more 2 spots on the lateral compartment, the proximal one, and then the inferior one around the retinaculum. In the proximal tib fib joint area, there's a few things that can get entrapped there. Basically, posterior and superior to the joint is where the common peroneal nerve has a branch that comes off of it. The lateral sural nerve. The lateral sural nerve goes down the lateral side of the leg, is cutaneous. It can get entrapped behind the ligaments of the tib fib joint, on top of the popliteus muscle. So also within like the popliteal like part of the capsule, which I'm going to have a lot of links in this episode. I'm going to have Joe link the episode I did all about the popliteus as well. In this area too, when we get to the level of the neck of the fibula, you've got the common peroneal nerves bifurcating into the deep peroneal nerve and the superficial peroneal nerve. The deep peroneal nerve comes more anterior along sort of the tibia, and then the superficial one stays a little bit more lateral, but up in that proximal area where they split is a common entrapment area, as well as there's a bunch of little branches in that area that start to branch off and go to the muscles. There's also a vascular entrapment in that spot. The vascular entrapment, as I said, when there's fluid in the lower extremity, it's going to be really hard to do deep tissue on it because it's going to give you that Coke can effect. And so hitting this spot just from a vascular standpoint is very helpful. Down that halfway shin area, it's going to be a combination of saphenous nerve and that deep peroneal nerve spot. And then down or inferior is going to be around the extensor retinaculum. This is another common entrapment of the anterior tibial artery and the deep peroneal nerve. And super common spot that needs to be worked on. In these areas, my favorite tool to start with is a silicone cup, dynamic cupping in this area. The added emphasis of the skin lift gets some stimulation of the lymphatic structures and just really helps to clear any of that fluid out of there that might be adding to the pressure problem. Now, here is an additional spot that sometimes I will hit on people, especially if I already notice they have a fluid problem. I will go back up to the thigh and do the area around the adductor hiatus, medial side of the knee. Okay. And then from there, then I will go ahead and flip them over. Well, actually, before I flip them over, I will also take the cup on the dorsum of their foot. The reason I take the cup onto the dorsum of their foot is it gives a skin lift to the deep peroneal nerve. Why do I care about that? Because it is going to affect a lot of the muscles in the joint into dorsiflexion. And so again, we're just reflexively sort of freeing up the nerves so they have can glide and slide and do their job. And then this sometimes will get rid of a lot of the reflexive neurological stiffness in the muscles, which is going to be easier for me to do deep tissue on them and less painful when there is not a neurological trigger point type thing for me to break. So then I'll flip them over on their stomach. And my first thing is going to be, sometimes I'll use the cup to get the rest of that adductor hiatus space, posterior popliteal space. And then I will start at the popliteus and the soleus. So if their popliteus is tight, I'm going to suspect that the rest of their deep posterior compartment is going to be tight too, because they are all part of the same compartment. So popliteus is part of the deep posterior compartment along with flexor hallucis longus, posterior tibialis, and flexor digitorum longus. Okay, so from this posterior side, after I work on popliteus, or while I'm working on popliteus, I'm also taking a flat hand and going down the lateral side of the posterior calf, hitting the soleus and the peroneals. The soleus is a big important one, and I'll have Joe link that episode in the show notes too, because the soleus is often called the peripheral heart. The soleus has a huge venous plexus within it. It's also a huge muscle, and it can have a lot of stiffness in it, but we really want to like kind of almost like, I don't want to say milk it, because like there is a massage term called milking and it's not that, but like I want to do a lot of flat hand work through that soleus, especially where it attaches to the fibula. And on that note, I'll have Joe link the fibula episode too, because I talk a lot about this relationship of the soleus. But the soleus and then the peroneus brevis, I attach onto the fibula right there, and that is like a key spot that always has a lot of tension, especially in my Navy guys. So then I continue down the leg. I'll do that a few times, and once I feel the fluid kind of have moved out of there, a lot of the tension on the soleus has changed quite a bit, then I'll orient myself at the base of their feet, and I'll use my thumb in a flat finger technique where I place my thumb, like the thumb pad and the flat part of my thumb in the lateral sulcus to the lateral side of the Achilles tendon there, and then I'll use my other hand to block it so I can add pressure to it and protect my thumb joint. And then I will strip out that lateral part of the flexor hallucis longus. That is the flexor hallucis longus. And you'll feel, especially if you get the fluid out of there, you'll feel that it's like flexor hallucis longus. And then there's a little change in feeling of fiber direction, because that's right where then you feel the peroneals and the flexor digitorum. I'm like making sure I have this right in my brain. Nope, the peroneals. Nope, now I gotta go. See, this is why you keep pictures around, people. But I'll work up that lateral side. And then eventually, after I clear that lateral side, naturally, my thumb gets kind of taken more medial to the middle as it follows the posterior tib. So I enter the posterior tib and in the posterior, first from the flexor, the flexor hallucis longus. And then it transitions, again, you fall off the flexor hallucis longus medially towards the middle, and it's posterior tib right there. So, sorry, I'm looking at a picture on the fly. Yep, yeah, I was right. Okay, yeah. So when you go up that lateral side, it starts as flexor hallucis longus, and then it's peroneals kind of the whole time. It's peroneals and flexor hallucis longus all the way up to the edge of the soleus attachment. And then as you kind of come up, you can move medial about halfway up the shin, and that gets you posterior tib. It's also kind of like a split in the muscles. And this is where it tends to be really tender, because this is also where things kind of drop in a little deeper and you're really compressing the tibial nerve right here. The tibial nerve travels that whole midline, but deep. But when you push really hard and can get really hard, it's going to almost always be tender right there in that middle spot. So don't smash it just to smash it because it's painful, I guess, is my lesson there. That because also in this area, there's a superficial nerve, the sural nerve runs right through there too. Okay. So then after you strip out that area, you'll start to feel your thumb kind of want to come on the medial side. So I switch thumbs. Come up the medial side. Now on the medial side, I am now on the tendon, and then the lower down like that, actually the muscle of the flexor digitorum longus, and as well as it takes me up flexor digitorum longus and posterior tib together. That medial lower part, again, around the area where on the front side, the extensor retinaculum attached, is an area that gets really congested, full of fluid, and like has just, maybe from all the stagnant fluid that gets in that area, just as like the flexor digitorum gets kind of glued down. And so that is an area that you need to spend a lot of time on, both from the posterior side, like I start, and then eventually, after I feel like I've cleared everything on the posterior side, I'll lay them on their lateral side and get in on the medial side. And on the medial side, you really are getting flexor digitorum longus, posterior tib, and the medial soleus. The medial soleus here can be very tight, up a little bit higher in the calf. And then even all the way at the top of the tibia, you're getting the insertion of the popliteus. So this medial side is really good to hit a lot of the deep posterior compartment. The other thing I'd like to point out, and one of the techniques that I think is underutilized for every body part, is what Philip Beach describes as the kebab method. You want to make sure you're doing manual therapy on things with the body in supine, prone, right side lying, and left side lying. So again, too, even when I'm stripping out that medial side, I go flat hand and I use my thumb in that blocking technique quite a bit. But then I also go back to the posterior and get it from that direction. Okay. And then if there's time, and if I felt like I needed it from that first bit of the anterior side when I got the lateral compartment, and then when they laid them on in prone and got the posterior side of the lateral compartment, if I felt like a lot of peroneal tension there, then I'll flip them and lie them on the other side, stack their legs so I can really get in around the border of the fibula and get the rest of the peroneal muscles that tend to be kind of covered up by the other things when we're in prone or supine. So that's the sequence. Tried and true sequence. That whole sequence actually is a video inside the swelling reduction protocol, because like I said at the beginning, this deep tissue on the lower leg is a really important piece of our fluid congestion and like need to do. The great thing is, most of the time after you do a few sessions of this, you only have to keep up with it like once a month, maybe every other week, depending on how much the person is on their legs for. But it's like, at first it's going to be really painful, but a lot of times it's really painful because of the reflexive stiffness, the neurological tightness, and the pressure from the fluid. So hope that's helpful. Lots of things for Joe to link in the show notes. A lot of episodes, often links to the swelling reduction protocol course as well. But full circle story, why I started telling you about my massage experience on Monday. And yeah, there was another practitioner on Threads too that was like, oh yeah, man, I wish you could see me, like I can really get in the calves, like. And then they were like, why is that not a thing? Like, why are so many people not very good at getting in the calves? I'm like, I don't know, because I tell my athletes, if the one bit of manual therapy they get during the month, during the week, this should be it. This should be it. Our lower legs need support, and when we support the lower legs, the rest of the body feels really good. Anyways, hope you enjoyed that story-ish and hopefully educational piece for you. But that's it for now. We'll see you next week.